Welcome to Angel's Watch. Today we are looking at another important health topic, pelvic inflammatory disease. Pelvic inflammatory disease remains a relevant public health concern due to its long-term effect on reproductive potential. It affects millions of women each year and is presently witnessing an uptick in Nigeria as well as many other countries. For instance, the Center for Disease Control and Prevention estimates that nearly 1 million cases of pelvic inflammatory disease are diagnosed each year, with 20% of cases occurring in adolescents, making it the most common gynecologic infection in the United States. What exactly is pelvic inflammatory disease? Pelvic inflammatory disease is an infection of the female reproductive organs. It results from untreated infection in the vagina or cervix that spreads. It often starts with an infection that begins in the vagina and spreads to the cervix. It then moves to the fallopian tube and the ovaries, causing serious health complications if left untreated. As such, pelvic inflammatory disease affects the uterus or womb, the fallopian tubes, the ovaries, or a combination. It often occurs among women of reproductive age. It is most common among women aged 15 to 39 years. This is because most sexual activities occur during this period. What are the complications of this infection? Pelvic inflammatory disease poses long-term hazards such as 1. Infertility, which is the inability to conceive a child or get pregnant. A woman who has pelvic inflammatory disease has a 20% chance of infertility due to the scarring of the womb and a 9% risk of future ectopic pregnancy. 75,000 women are reported to be infertile every year on account of pelvic inflammatory disease in the United States, accounting for 10% to 15% of infertility in the United States. And according to Center for Disease Control and Prevention, 1 in 8 women who have had pelvic inflammatory disease have difficulty getting pregnant. 2. Ectopic pregnancy, the pregnancy that occurs outside the womb. 3. Long-term pelvic and abdominal pain. 4. Formation of scar tissue both inside and outside the fallopian tube, and this can lead to tuber blockage. Quickly, we are going to look at the causes and risk factors of pelvic inflammatory disease. Sexually transmitted bacteria are the most common cause of pelvic inflammatory disease. Chlamydia is the most common, followed by gonorrhea. These two sexually transmitted infections causes about 90% of all pelvic inflammatory disease cases. However, one can develop pelvic inflammatory disease without having sexually transmitted infections, and the factors that can heighten or increase one's risks are 1. Having sex under the age of 25. 2. Having multiple sexual partners. 3. Having unprotected sex, that is, having sex without a condom. 4. Douching or douching, which is the practice of washing or flushing the vagina with water or other fluids. 5. Having sex during menstruation. Then 6. Having history of pelvic inflammatory disease or sexually transmitted infections. Less commonly, pelvic inflammatory disease also occurs when normal bacteria in the vagina travel up or get into the reproductive organs, and this can happen after childbirth, miscarriage, pelvic surgery, and after getting an intrauterine device, that is an IUD. Having looked at the causes and risk factors of pelvic inflammatory disease, we are going to look at the signs and symptoms of pelvic inflammatory disease. Signs and symptoms of pelvic inflammatory disease can be mild or difficult to recognize. Some women do not experience any signs and symptoms. As a result, one may not realize that one has it until one has trouble getting pregnant or develop chronic pelvic pain. Sometimes, symptoms of pelvic inflammatory disease resemble those of ovarian cyst, appendicitis, endometriosis, or urinary tract infections. One should therefore seek medical attention if one notices or experiences any of these. 1. Pain in the lower abdomen or pain in the lower abdomen and pelvis, ranging from mild to severe. 2. Unusual vaginal discharge with a bad smell, usually yellowish or greenish in color. 3. Pain during sex. 4. Unusual bleedings from the vagina, especially during or after sex or between periods. 5. Painful or difficult urination, that is, having a burning sensation when urinating. 6. High temperatures, which is fever. Then 7. Painful or heavy periods. Quickly, we're going to look at the prevention of pelvic inflammatory disease. The most effective measure for the prevention of pelvic inflammatory disease is the prevention of sexually transmitted infections. Therefore, risks of pelvic inflammatory disease can be minimized by 1. Practicing safe sex, that is, limiting sexual partners or using condom with a new partner. 2. Having regular screenings, especially those who have multiple sexual partners. 4. Ensuring that sexual partners are tested for infections or sexually transmitted infections. 4. Avoid douching to prevent pushing bacteria upward from the vagina into the fallopian tubes and the uterus. 5. Not having sex too soon after childbirth, termination, or loss of pregnancy. Then 6. Wiping from the front to the back after using the bathroom to prevent bacteria from entering the vagina. Finally, 7. Seek medical attention if you notice symptoms. Remember, your health is a concern. Do not forget to subscribe to this channel for more health videos. Stay safe and see you in these videos.